A very good evening and welcome back for another session in the series of Meeting an Expert. We have a very special guest today and a very special topic, a timely topic that we could focus on. So without further ado, let me invite our chairman, Mr. Bandulai Gudage, to share his expressions and wishes with us. Chairman, over to you.
Thank you, Kaushali. Good evening to everybody. Professor Suranjith Seneratne, thank you very much for being with us. On behalf of APIT, especially our CEO, Roshane Godege, and the board of directors, entire staff and the student population, I take this opportunity to welcome you and at the same time, thank you for spending your time for our invitation and this worthy cause. Professor, I think I don't have to introduce APIT to you, but I'm sure you are aware that APIT, known as Asia Pacific Institute of Information Technology, for the quality education. So we believe in the management and also the entire staff believe that we are making not only the academic people, the students with academic excellence. We want to have people with all the surrounding skills, like especially the leadership skills, and also they should be able to have a well-rounded personality when they are coming into the society. So today actually we are discussing very important factor. These days no business can divide COVID and economy separately, because it goes hand to hand. In basically, if somebody is not aware of COVID, that means he is not aware of anything. That is the understanding that we have, especially in commerce angle, especially in the social angle, or you may be calculate in many ways. It is the actual fact. So, Professor, with your experience, we would like to share with our students. We are giving a huge opportunity which we didn't have during our childhood. Our students will get a massive opportunity to deal with you all, like opinion leaders like you all, to have direct interaction. So I think it's initiated by Dr. Rohanta Atukorala. Thanks for that, Rohanta. This is a series of activities. So without taking much more time, Professor, thank you once again. And I will leave it over to you and Kaushali and Rohanta to take this up. And also, in the meantime, even though Dr. Rukshan Bellana is not there, I welcome him. I think Rohanta spoke to me and said that he will be joining soon. I welcome him as well. So over to you, Professor Suranjit. Thank you very much for being with us today.
Thank you, Chairman. Let me take this opportunity of introducing a very eminent human being that we have Sri Lanka has produced. We have Professor Suranjith Seneratne, who is the consultant in clinical immunology and allergy institute of the Immunity and Transportation, Royal Free Hospital and the University College London, UK, and the Health Services Laboratories, London, UK. Professor Suranjith is a very, very outstanding personality. He completed his basic medical degree at the Faculty of Medicine, University of Colombo, with first-class honors, 8 distinctions and 10 gold medals, and was placed first in his year. He completed his MD in internal medicine, trained in clinical immunology and allergy at the John Redcliffe Hospital in Oxford. He completed doctoral philosophy in molecular medicine at the Weatherall Institute of Molecular Medicine, University of Oxford, as a Commonwealth Scholar. So far, he has authored 256 journal publications and has published in journals such as Nature Science, Nature Medicine, Blood, American Journal of Medical Genetics, American Journal of Human Genetics, Journal of Experimental Medicine, and Journal of Allergy and Clinical Immunology. Professor Senaratne is an international expert in immunodeficiency, autoimmune, allergic, mast cell disorder, and immunologistics. He's the director of the Center for Mast Cell Disorders and the president of the UK Sri Lanka Immunology Foundation, an organization that contributes to immunology, allergy education, and education in Sri Lanka. I mean, I have met so many personalities, who have traveled abroad, and we have actually exported this fantastic talent to the UK. But a person who is having so much of acumen is very few and fine between from Sri Lanka. So it's actually an honor to introduce Professor Suranjith. And I'd like to thank Dr. Rukshan Belana, Medical Administrator, Minister of Health of Sri Lanka, to be coming in subsequently as an expert panelist. He is the Medical Administrator for the Minister of Health, President Government Medical Officers Forum, past Secretary, College of Medical Administrators of Sri Lanka, Fellow of the Seoul National University, South Korea Medical Administration. He was the Deputy Director, Colombo South Teaching Hospital in 2020 to date. Director, Laboratory Services, Minister of Health, 1990-2020. Director, Blood Transfusion Services, 2017 to 19. And he was Director, National Institute for Nephrology Transport and Dialysis between 2013 and 2015. Deputy Director of Mahamudra Teaching Hospital between 2010 and 2013. Director, Polonnaruwa General Hospital, 2009 to 2010. And of course, he was the medical superintendent of the base hospital in his early life of 2006 and 2008. And actually, I'm honored because he's my classmate, Dr. Rukshan, and I mean, he's a beautiful human being who's also joining to discuss today's key topic, the lessons from UK on COVID-19 management for Sri Lanka. Professor Suranjith Seneratne, over to you, sir.
Thank you, Rohanta. Thank you very much for the introduction, and thanks a lot for the invitation. And Mr. Egodage, thanks a lot. And it was lovely to be with Rukshan also. It would go a long, long way back, three of us. So thank you very much. And it's wonderful to speak and discuss a topic that all of us have been involved in some way or another during the last 16 months. So what I'll do is, so thank you again. What I'll do is talk to you about some lessons learned with regards to COVID-19. And I will just sort of arrange this as the basics, disease patterns, lockdowns and relaxations, which all of us have had at some stage, viral variants, and talk about the vaccines. Now, we know the number of cases. You can see the number of cases in the world, in Sri Lanka, Malaysia, India, UK, and US. And as you see from this slide, the UK and US has really, really had it bad during the last 1.5 years or so, because the number of cases and number of deaths have been quite high. India, it's issued now at the moment, and in Sri Lanka, there has been an uptick of cases. So all of us have been in this together. We can all learn lessons from each other, and that's the key message. It is not one way, it's learning messages, and no one can get it 100% correct. People have to change tact as it goes on. So we all know this is the virus that caused the problem with the spike protein on the surface. It's called the SARS-CoV-2 virus, which causes COVID, the disease called COVID. And this has caused a major amount of deaths and hospitalization. Now, as immunologists, we have, and other scientists have learned about the immune system, the changes in the immune system, the cytokine levels being high, the cells being low, some cells being high, etc., the coagulation. And knowing this is very important because it allows us to target treatment appropriately, steroids, remdesivir, tocilizumab, etc. And big trials have gone on in management. Now I'm talking to business class, so I wouldn't want to go into great detail of that aspect, but I'll talk about other aspects about the lessons that we can learn here. So what about the disease pattern in these different countries? Now, at the start, we know it started in Wuhan and then it spread, and very, very quickly, the virus was sequenced. That is, all the letters, all the sort of amino acids that form, and all the sort of letters that form the genetic code of the virus was identified, and it was released to the public. And that allowed people to proceed very fast with diagnostics, very fast with treatment options. That is very important. Sharing data was a very important aspect in this early part of the pandemic. Then you had other bodies coming in, the FDA, the EMA, that's the European Medicine Agency, etc., to be able to coordinate the drugs being developed, etc. Now we know that this is a timeline. It's a very busy slide, but I just want to tell you the amount of stakeholders. This is the reason I'm putting that slide, the number of stakeholders that were involved in getting the lockdowns and the release occurring at different time points in the UK. So that is a very important thing to remember, that there were different stakeholders involved. So if you look at the model that was modeled, the graphical representation, you had the increased number of cases. And very early on, the issue was, can we allow people to get the infection and get herd immunity? But that was not going to work because people were dying, people were getting to hospital. So they had to bring in a lockdown. And then the number of cases went down. With the lockdown, we know that. And then what happened was release. People went on holidays, people went on to eat. They were being paid or given discounts to go and eat, and then again we had another sort of uptick come in, and then again we had to go into lockdown from around December. We again went to lockdown, and this has been the pattern, and we are just coming out of lockdown at the moment. But in India, you can see the uptick of cases, the big uptick of cases from mid-March, and several reasons have been put forward, including relaxation, social distancing, together with the variants that are spreading there, the UK variant and the new, as we call the double variant or the Indian variant, which was reported on the 25th of March. So these are some of the reasons that were responsible for this sort of lockdown coming. And this doesn't involve only one country. We have to work as a global entity, because now there are a number of cases of the Indian variant increase in the UK. Certain areas have been put into more stringent measures, such as Bolton, etc. And this is a very important thing to realize, because some of the opening that is occurring in the UK may be affected by things that happen in other parts of the world. So what is the take-home message of this? You do not work in isolation. You can't vaccinate your whole country and then expect everything to be okay, because if other places are not vaccinated, if there is a lot of transmission, there are new variants, there is going to be problem as it goes forward. And so that's a very important take-home message to learn from this, because people around the world should be vaccinated, social distance should occur. So I'm just bringing these few slides to tell you, you all know in your course, you all learn different types of leadership skills that are needed. Different people have different skills. And there should be a combination of these different skills to respond effectively to a crisis. So you have to find out what is happening. You have to face the crisis. You have to be vigilant. You have to prioritize. You can't do everything at the same time. And then you have to know what you can control and what you can't control effectively. So those are important things that are there, and not everybody can be a leader. There has to be some people who follow, some people who have to do the job. So it's a combination. Like any organization, you have different people working as a team to be able to deliver the process. You have these decisions being made. You all do this always in business, but in medical administration, etc., we would have Rukshan will outline this very clearly. This is what they do. I mean, when they take into what is helpful, what is harmful, what are the strengths that we have, what are the weaknesses, what are the opportunities, what are the threats. These are regularly taken. It may not be put down like that, but these are what go when you make certain policy decisions. So using that, you have certain important pandemic response key areas to focus. You want to reduce the number of people going to hospital, because if the hospitals are overwhelmed, that is a big problem. The whole system breaks down. You saw what happened in Italy. That is something you really want to plan for. You want to have staff safety. You want to, because they are the ones who are looking after the patient. You have to have adequate supply of equipment and other tests, etc. So those are key areas to focus on, and you will, as a team, focus on these different areas. You have testing methods, and the important thing is, once these decisions are made, communication is so essential. Leadership, communication. It should be a clear message. It should not be too complex. It should not be too long. It should be a message to tell what should be done in this scenario. Because if you give a very mixed message, then people would be wondering what should be done. So that is an important thing that was learned during the pandemic in the UK. And the important thing of using the sort of the internet, etc., track and trace, it's very important, because sort of telemedicine, using the internet, using the smartphones that people are carrying also is important in a certain group of people. Not everyone would have a smartphone, but using the correct resources in the correct environment is important. So leadership, clear messages, and using the resources available at that point to be able to deliver the important things going forward. So that is some aspects about the disease patterns, and there was the lockdowns, etc., how it was managed. When we learned during the pandemic, not everything went beautifully. No country can say we did everything beautiful. That is not the case. I mean, every country did something, they found that may not be working, they had to change tack, and that's the important thing, to be flexible, to change tack when you have to change, rather than being on one aspect alone without changing tack. So next, let's go about the lockdowns and relaxation. So we had a lockdown and we came out of relax, and you can see that, end of May, end of June, end of August, there were very, very clear guidelines. But despite that, what happened was people are people. They went when the lockdown, they went around, they were close. So the lockdown did work. The number of cases did come down, and it's very important. We are in mass social distancing, sort of the washing hands, it's very, very important. But then as soon as you released it, back again, the cases came, and with the variants, the cases came back again. And there were mixed messages at that time. Different countries in the UK were telling different things, different countries in Europe were telling different things, etc. This is one thing we learn, try to coordinate the message so that one message goes out, because otherwise, if you were living in Wales and in England and in Scotland and in Ireland, different people were getting different message, and that's you did something and then you learn from that, and that is to be flexible. So I told you the number of cases went up again, and then again we had another lockdown coming in, and then we are just coming out of this lockdown, but it's very much more gradual. You cannot just take the brakes off. And you can see I put the step 1, 2, 3. We are in step 3, right? And we will go into step 4. We are in step 4 and in May 17th, and we will go into the hopefully, unless the variants cause a big problem at the present moment. So there is a very, very clear guideline as what can you do and what can't you do. And if you don't do that, there are people who are protesting, etc., but you will be managed with the law if you do not follow the step line. So what are the conditions for easing step line? These are decided by policymakers, etc. Vaccine program should continue. That is the important. Social distancing and vaccine program together, because the UK has learned that only social distancing alone may not be sufficient. Together, hand in hand with the vaccination program, is what could potentially reverse this pandemic. That the vaccines are reducing deaths and the number of hospital admissions should be shown, which has been shown. Infection rates are not risk of surge of the hospital admission, that there won't be a surge, and new variants do not change the risk. So that is being monitored very, very carefully about the new variants. And as I said, the Indian variant at the present. So these are the stages that have been laid down, and we are at the different stage, and the next stage, it will be dependent on so many factors that are in the circulation at the moment. So the important thing to remember is that is why y'all, as BA students, y'all will end up as the business leaders, leaders of public bodies, leaders of different organizations. And when you put something into place, you would always look at the potential impact and how you can mitigate it. It's a very complex slide. I mean, but people have done this. They have modeled it. What is the potential impact of full lockdown, partial lockdown, no lockdown, etc., a full release? I mean, so you will be able, and how can you mitigate the issues? And that is an important thing when you are doing sort of planning, etc. So I've spoken to you about disease patterns, lockdown and relaxation, next about the viral variant. This is a big sort of spoke in the whole process, because that is things that can derail countries' sort of programs as it goes forward. So you know that there are a number of variants. People have written about this, I've written about, lots of others have written about. There is the UK variant, the South African variant, the Brazilian variant, and the Indian variant. Those are the variant of concern. Now, it is named so because it was the first country that the variant was detected, not because it's the most prominent there. And each country has to be aware of these variants, because if some variants are more transmissible, they transmit very much more rapidly from one person to another. Some have a problem with vaccines, like the South African variant. So that is extremely important for us to monitor those variants and have a handle on those. These are the characteristics of the variants. Again, I won't go into detail because, I mean, these are looked in by specific bodies, but we must know that these variants are existing in different countries. So I told you about lockdowns. I told you about relaxation. It does work. Everyone knows it works. We have to continue it. However, I think after many months, we have realized that in addition to lockdown, you need something else going hand in hand. And that is what we are learning. That is why lots of countries are pushing forward to get the vaccines rolled out in their country and globally. So we have about 7 vaccines that are approved or authorized at the moment. We have the mRNA vaccines, which are Pfizer and Moderna. We have things called the viral vector vaccines, AstraZeneca, Gamaleya, J&J, etc. And then we have a killed vaccine, which is Sinopharm. They have different characteristics. Most of them need 2 doses. So if you need 2 doses, you have to get 2 doses. You can't be managing 1 dose if it is recommended to have 2 doses. That is, 1 dose will protect to a certain level, but you need that booster. There's one J&J, which is a 1-dose vaccine, and the efficacy is given there because clinical trials talk about efficacy. So these are the vaccines. Novavax vaccine will be approved very shortly or authorized very shortly. So, but we must remember that the vaccines came aboard very quickly. They didn't take shortcuts. They followed all the protocol, and there were 4 that were abandoned. We must remember that, because not every vaccine was successful. Some just did not work, and we had to abandon it. And all the vials that were made in that had to just be thrown away. So that is an important aspect to remember. Vaccination being rolled out. You can see the countries with highest amount of vaccination, Israel, etc., and several other countries are really focusing on vaccinating the population. But we must not forget that the global population does need to be vaccinated. It's useless vaccinating a 18-year-old in the UK and not getting a healthcare worker in Asia and Africa vaccinated, because that is not the way to go, and that is extremely important to focus on that aspect. So again, this is showing the sort of the countries with the highest rate of vaccination, but it should be across the globe and not focused only on 1 or 2 countries. These will show that the vaccines are effective, etc. But to get this pandemic, we must push it right through. So the UK, one thing was they focused a lot from about June last year, 2020, they put in money to develop vaccines, they ordered the vaccines, and they focused a lot on vaccination very early on. The scientists kept on giving advice that in addition to social distance, we do need vaccines at some stage, and they put in a lot of money. Pfizer vaccines was rolled out as the first vaccine December 8th, and this was the lady who received it. And there was a nice plan that went on, and this was followed. Everyone has to follow it. NHS, the 9 groups, you follow it. You cannot break it out. You can't break the rules and regulation. You have to follow it. And now we have come, all 9 groups have been vaccinated. And these were the groups, the population in age 9. And the groups that were vaccinated. And that's a very, very important aspect. If I give you a personal view, I have 2 children who are less than 25. They have still not got the vaccine, because although I speak a lot of, because they found that the people who die in the UK, who get hospitalized, who get to ITU, are the older people with comorbidities and the immune deficient patient and the cancer patient. So they focused on that, because if they can reduce deaths, that's the important aspect to remember. Messaging was always present, clear, short messages that were not confusing. I mean, but this is an important thing to learn from, because sometimes one message may not be clear. So then you have to change the message again to make it clear, because not everything works 100% every time. There was vaccine hesitancy, but that is improved. And now a lot of people are wanting to get the vaccine, because the ultimate idea is some immunity is better than no immunity. So if you don't take a vaccine, there will be any immunity that you will develop unless you get the SARS-CoV-2 infection or COVID. So if you get COVID, you can get immunity, yes, but at the same time, people will die, go to hospital, overwhelm that system. So that is what we're trying to do with vaccination, to be able to give you that sort of immune response to prevent a person getting severe COVID. That is the most important. Again, people were told what to expect in vaccination, before vaccination, at the time of the vaccination, after vaccination, etc. And the messages have to be refined as time goes on. Has it worked? Yes, it has worked. You can see the peaks. We had a peak, then a second peak, which is big, and it reversed. Number of cases have reduced, number of deaths, number of hospital and number of ITU care, and this is the peak after vaccination. Importantly, they're looking at the Indian variant. That is a very tricky variant at the moment, but overall, the important thing is that together, social distancing and vaccination has helped reduce the number of deaths, etc. So in this quick update, I told you about the basics, SARS-CoV-2, I told you about that infection, I told you about the disease patterns in different parts of the world, in the UK and the rest of the world, lockdowns and relaxations, lockdowns do work. However, then you have to bring it in with the vaccination. And I told you about viral variants as an important aspect to be considered. Thanks a lot. Thanks.
Thank you very much, Professor Suranjith Seneratne. It was actually fantastic how clearly you explained with absolute serenity. It's actually lovely to see this kind of depth of thinking, and thank you so much. Dr. Rukshan Belana is there, he's joined us. Rukshan, you there?
Yes, Rukshan was there.
Yeah.
Hello, okay.
Hi, can hear you. Can see you.
Okay, sorry, I was muted.
Yes, lovely seeing you, Dr. Belana, and appreciate sincerely for your presence. So we'll have a slight chat about Professor's view on COVID. Professor, let me start from you. I mean, I know that you're based in UK, but how do you see Sri Lanka pan out in the next 2 weeks? I mean, we are in absolute problems in Sri Lanka, as you know. Our yesterday we had about, I think, 31 deaths coming in, and our spread rate is very high, touching 2,600. How do you see this, Professor?
Yes. So, Rohantha, I mean, we know the way the disease pans out. You get infected, and it takes some days for the person to get symptoms. So that is the nature of any sort of infection. You have a sort of a period at which the virus gets to a certain level. Now, we know that there was an uptick around just after the festival period. and there is transmission that is occurring between people, and people are getting infected. So the important thing at the present moment is that it has been restricted. Movements have been restricted, and that is important. People's social distancing, wearing masks, hand washing, etc., is important, because I think you have to break that cycle. And at the same time, so what you're seeing in the cases increase and the deaths increasing would occur because there is a lag period, and the same thing is happening in every country. It did happen, right, when it started increasing. But and in India that happened, and the commentators say it might occur for about 2 weeks more in India, and then it will turn around. So I think the important thing is to bring in these processes into place with vaccination. I know there's a massive global shortage of vaccination. I mean, this is not only in Sri Lanka, Bangladesh, everywhere. I mean, that is a very, very sort of critical, acute thing. And for the MBA student, important, they always learn about demand, supply, etc. And this is very, very critical, right? I mean, everyone wants a vaccine. Overall, what I would say is, because there is a lot of people asking to get this vaccine, that vaccine, etc. I mean, ultimately, the message we had from the UK at the time when there was a shortage of vaccines was, again, in many countries, where the US said, get any approved vaccine, because if you try to wait, COVID cannot affect you, and you can die with COVID. You can get infected. I mean, it's important that the medical bodies, etc., get the vaccines, right? Try their best to get the vaccine. But once a person is offered the vaccine, refusing this vaccine, that vaccine is not a very appropriate option, because if you don't have any immunity, some immunity is better than no immunity. So that is important. So social distancing together with vaccines would reverse the process, but it takes some weeks to happen.
So what is it? I mean, there is no conclusive research, but what is your view of combining different vaccines? Because as you know, we have about 900,000 AstraZeneca recipients, and now we got only 300 for the second dose. And we know that the Serum Institute in India has said that they will not be able to send anything at least till the mid of July, because they want to meet the local demand. So what is the thinking, Professor, there?
Very good question. I think that's a very topical question, Arvanta. So now we got a certain amount of vaccines, and as expected, like what the UK did, they wanted to get as many people vaccinated, at least one dose of vaccine, because that would help. That's the same process the UK went. They got many people vaccinated. But then, very unfortunately, what happened was the cases in India increases and they shut down. And that happens and that is a good example of in business, sudden unexpected event occurs, and the whole thing, you have to rethink your strategy. And that's what you do. And that's a very good learning point. How do you rethink? Right. So we had 900,000 people getting one way, and there were 300,000 getting. Now, the bottom line is, if you can get the AstraZeneca vaccine, absolutely AstraZeneca vaccine is second. There's no doubt about it, right? So it's on the table. There's nothing about mixing. Tomorrow, if you get another 100,000 people, 100,000 more people will get the AstraZeneca. The issue occurs is what are you trying to compare? You're trying to compare the alternate. Say you just can't get the vaccine, okay? Just cannot get that. So, I mean, they will negotiate with the UK government, with the Canada, with a lot of can we get. If we can get the vaccine, that's wonderful. Now let's go. We can't get the vaccine. So then, what are the options? One option is, okay, you get one vaccine, don't take another vaccine. That's not a good option, because these are 2-dose vaccine. These are not 1-dose vaccine. They're 2-dose vaccine. So you need that boost. You want the boost to occur after some time. You want the immune boost to occur. Then the second thing is, okay, let us wait till October to get the immune boost, because by October or August, we might get some AstraZeneca. The problem there is that, you want to come with a boost at the correct time, not at the wrong time, because it's like an athlete. He's he warms up, you go and do a 400 meter, you do a 800 meter, now you want them to go and do a 1500. You want them when they are good, the immune, when they are sort of felt running properly, to get the boost in and get them to get the other. While if you wait and you allow the immune system to go down below a certain level, you're increasing the risk of the person getting infection. Now, it's not going to drop to zero in one day. That's very important to remember. It's not, today I'm okay, tomorrow I'm no immunity. Not like that, but it will just go down. So then the thing is, okay, can we wait 12 weeks? Okay, 10 to 12 weeks is a thing. Can we wait 14 weeks? And the general understanding at the moment, there are no studies per se. General understanding, 14 weeks you can wait, okay, after about 14 weeks. But then what happens after that? Then the assessment is, what happens if you can't get any vaccine? What happens if you can't get the AstraZeneca? Then the thinking is, wouldn't it be better to get some other vaccine? Now in another country, it would be, say in the UK or in Europe, it would be the Pfizer vaccine or Moderna. Now those are not in Sri Lanka. The studies that have been done recently and published, one small study, the interim analysis was on the AstraZeneca, Pfizer, AstraZeneca, Moderna, or actually the Pfizer one that was published recently. So then the question that you have to ask is, okay, what about Sinopharm? What about Sputnik? If those are available, could you combine? Now we know that there are no studies because the West is not doing those studies, and exactly because they are not being registered there. So the question is, do you wait without a vaccine? Do you wait without don't get a second dose? Not a good option. Do you get the second dose after, say, about 20 weeks or 25 weeks? Again, immunologically, is that a good option? Do you combine it with a vaccine that is available? That's something like in the country at the time. If it is Germany, as it happens now, France, Finland, Norway, Sweden, and Denmark, all of them are giving a mix in the patients who receive the AstraZeneca first. They're all combining now, right? Because they have said they don't, if they are under the age of 50, they don't want to give the AstraZeneca as a second dose. They're giving them AstraZeneca first, millions of people. They're giving either Pfizer or Moderna because the other two vaccines are not registered in their countries. Other they may have had to consider that option. In the UK, any person who is under 40 who would receive the AstraZeneca is offered another vaccine. So there is mixing and matching already going. So the question there is then, how long can we wait without getting the AstraZeneca? Tomorrow, if you get another 600,000 doses of AstraZeneca, you wouldn't even think of this question about mixing and matching, etc. Right? But it will come in the future. I mean, definitely it will come in the future because countries are thinking of a third booster. Right? People. So what happens if you took AstraZeneca, and you find the third booster is better in, say, Sputnik, let's assume, right? So are you going to say, no, we don't want the best vaccine coming third, we want the second because we had AstraZeneca? So those are the questions that are coming up. Those are questions that immunologists are looking at. Those are questions that people have to speak about. It's important to speak about. I think you have to tell people this is the discussion. You don't have answers. 100% answer for every question. I mean, that's an important thing to remember. I mean, otherwise, scientists are also learning, but once they learn, they change tack and keep the people safe. So that's a long, drawn-out answer. Sorry that it took a long time, but I just thought I had to break it down to explain it, the current sort of position that people are thinking about.
Professor, I mean, you answered absolutely to the point, and I wish there are people in Sri Lanka who can also be so straightforward in their discussions. I'm going to turn to Dr. Rukshan Bellana. I mean, a very distinguished gentleman and cricketer during school times, and it's so fortunate, but it was your dad who was outstanding cricketer who trained him.
Absolutely.
So it's actually a beautiful platform that we are in. Dr. Bellana, what do you think? Where has Sri Lanka gone wrong on this?
Professor
How are you?
Suranjith. Actually, I have to say where we have gone wrong is we have lost the principles, the basics of controlling an epidemic. So actually, the success of our history shows that we have been successful in containing the whatever the epidemics that came into the country. Why? Because we have privileged to have a universal health coverage, can proudly say, compared to other big giants or countries in Asia. We have a very good system. System is established, universal health coverage. We are almost there, like any other developed countries. But what we lacked here was uh, we didn't, the health staff did not take the lead in controlling the epidemic, unlike in the previous times. For example, uh, SARS was a threat to come into Sri Lanka. You had a lot of other, epidemics that were roaming around in the world, especially in the areas like Hong Kong and other Southeast Asian countries. But we were able to handle it without getting into the country. Even if you take, when you take the tsunami, post-tsunami health devastations were not noticed in Sri Lanka because we managed it well. So why we managed it well? Because we have a good system, a system more like centralized government control, and so the coordination and communications are very effective. But unfortunately here, I feel whatever it is, we still lack a global initiative in controlling the pandemic or attending to the pandemic. We are all, as countries, all alone struggling to battle this epidemic or pandemic. So India is having its own problems, UK is struggling on its own, US is struggling on its own, and Sri Lanka. So we need to, like, when in 1978, when we all thought the WHO got together to say health for all by 2000, we need to meet up the entire world. WHO, maybe the WHO can give the leadership and say we need to eliminate the this coronavirus from the world, the disease, COVID-19 disease. We need to eliminate it. Therefore, we have to have a global initiative, not just that country by country. We cannot handle it, because although this is like, each country has various variants, maybe dominating the scenario, but you need to, the whole approach can be almost same. Yes, I think what professor said was there, but I think in Sri Lanka we need to, with the health staff, need to step up more aggressive approach. The whole success of our history in Sri Lanka was how the midwives, how the community nurses, how the public inspectors in Sri Lanka, public health inspectors in Sri Lanka, went home by home, went person to person and said, please put your mask, please wear your mask, please keep the distance. It's very important. And then how they were told in Sri Lanka, hand washing was the world faced so much of infections due to dirty hands in people, and infections were so many infections were occurring as a result of that. But the hand washing made, apart from the antibody and antibiotics, change the entire infections in the world by just keeping the hands clean. Therefore, these basics are not given to the public. I think 1 year and 4 months have gone. We need to concentrate on these 4 5 basics, where that can prevent, plus the vaccination. But the people think when you look at Rohanta, the roads in Colombo still today. Today, when I was coming after work home, I take about half an hour. There is about half an hour drive for me, and I see a lot of beggars in the red lights begging without the mask being put on properly. Therefore, the seriousness of this is not applied well. Why? Because health authorities must now. I told in a TV interview that actually why is the vaccination of children in Sri Lanka became very successful in terms of the results. Why? Because it was the empowered, the woman in the house or the female person in the house was empowered the responsibility to take the child on time and give the vaccines on time. And then about other related issues, how you prevent. Our prevention was very successful in the past, but now I feel still we are somewhere not in order. We don't do enough for the prevention, and people are not given the required basic. They think it's a joke, distancing, social gatherings. I have a question for Suranjit also. You see now from last January to now, people have to wear masks for the 1 year, 5 months period. And at work, for example, if you are at work, you are totally wearing about the mask for 7, 8, 9 hours, 10 hours. What repercussions will this give to the people with a constant wear? Okay, you get prevented from COVID, but then what are the other consequences that you may face as a result? For example, if you are having chronic respiratory tract diseases or some obstructive diseases, whether wearing the mask will support it or whether it will cause some further aggravation. So we don't know. So therefore, but anyway, these young people, the healthy people should wear the mask right now. Yes, because there is a community spread right at the moment. But we have been wearing masks from last January, when the societies, the countries saw only few hundred of patients positive, but of course there could have been more patients in the society without being
Dr.
traced.
Belena, if I may come in now, Dr. Belena, I mean, I think this is the first time in our life that we have heard acceptance that COVID has got into as a community spread, because the state continuously denies that we are into community spread. So now
I think
my question, sir, is now we have about, I think, 700 beds with ICU facility, and we have I think, an escalation of about 1,000 people every day, because today we have a confirmation that 3,150 people have got it, and about 1,005 to 1,007 people will get discharged. So the numbers are now picking up 20,000, Dr. Belena. So are we secure, sir?
Actually, this is where sometimes I feel we need to have a preparedness, pandemic preparedness, in that we need to prepare the ICU beds and other facilities to treat the patients in intensive care. But don't forget that we need to prevent this getting it. I mean, that is, we need to emphasize more on the prevention than how to prepare the beds, the intensive care beds, how many intensive care beds we might need for the next 1 month or so, how many oxygen cylinders we need. And so, no, we have to be aggressive. Actually, to tell you, Rohanta, although the government has not accepted that there is a social spread, the doctors, the specialists have come out. I have seen on TV on several kind of specialists, especially the COVID-19 related specialists, have told clearly it's a social spread. Therefore, what we need to is like how we prevented most of the pandemics in Sri Lanka. We need to give the baton to some, not only the health workers should do the battle, but we need to train the public now. It's a big how to behave in the society, how to act, and to live with this understanding so that you are prevented from getting the disease. After getting the disease, treatment and how you get set about with your plans is a different story, Rohanta. So it is what it's my personal view is that we are not doing enough for the prevention. You see, the policies wise, we don't apply the policy to everybody the same. You see, sometimes VIPs, I don't have to name the person, have big funerals in the middle of the lockdown, right? When there is a VIP father when from the upcountry died, the funeral was attended by many thousands, and then so many, the same thing don't apply to the entire nation equally. So we have not seen this type of, when it comes to pandemic disaster, it's very important that strict rules are applicable, because the virus don't select the social category. They attack the entire category of people irrespective of the status. So because of that, we haven't been consistent in the processes of lockdown, in the basics where we have to keep the distance, we have to wear masks. We are not consistent, and a lot of people I have seen on the roads don't wear the mask properly. They think it's a legal requirement for the people to wear the mask, but they don't think it's as a compulsory to prevent the disease. This is where we are bit wrong in comparison to how we handle our pandemics before, for example. Before. So we have had a lot of success, isn't it? We have eliminated polio from the country. We have eliminated malaria. We have almost eliminated the status of malaria, filariasis or filaria, you call it. And then measles, we have a big success. When you were small, Muranta, so many people used to get measles when you were in the school, or chicken pox. Yeah, but now we hardly see that because we have been successful, and vaccination was the main thing. But before reaching the vaccination, the mothers were educated. But why we are successful in this country in terms of the healthcare is mothers, the female literacy in relation to health literacy is very high. The mothers, I mean. Mothers, so which prevented, and of course the role of a mother in the house is also very important. When you say when the husband goes out, when the children goes out, you being the mother, advise or guide the family. But it has not come to this level in Sri Lanka. A lot of people think it's like a joke. They take it as a joke, wearing the mask, keeping the distance, these type of things. They take it as a, not serious. This is what I feel for the last 1 year to 4 months. And, I don't quite agree with the fact that some people say the Sinhala Avruttavurudhu period, New Year period, in April caused this escalation. Of course, I believe that, of course, true, it may have contributed, it may have the reason, the movement, when you allowed free movement for the public during that period, it escalated. But the thing is, how come the variants of British variant Indian variant, and so many other variants came into the country. That is because we were not consistent. For example, we allow some of the people, like heroes, to bring in tourists to the country, selective people, and we don't allow. I mean, there are so many players in Sri Lanka with regard to tourism, how they perform, and you don't allow all the people to act equally. You allow some one person selected to bring in, at a time when Ukraine was going through the British variant, and when the entire Ukraine was locked down, we were proudly bringing in tourists from Ukraine, and then you know apart after bringing in tourists from Ukraine, they proudly said no, there is a what do you call this, bubble, right? Bubble, and that they no, all nonsense. They didn't adhere to the bubble uh, rules. They were not. So now we see we got the British variant here in Sri Lanka. Do you think it is from Britain that we got it? No, I don't think. I think it came to Ukraine, and from Ukraine it came to us, or some other way. Indians, how the
Professor, I like to turn to you. Don't you think that your dad has produced a fantastic product for Sri Lanka?
Not as
yes.
What do you think of doctors' thought about the mask? I think actually, I never thought about it. Do you feel there is some? How would you answer that question, Professor?
So I think mask has been sort of from the time the pandemic started, or before that has been, some people accepting, some people not accepting it. And, the US, the WHO, the UK, there has been lots of things. And different people fall into different categories. But I would agree with Rukshan. I mean, at this stage, we are in a mask and we are in it properly. And, which uses wear it on your chin, not with your nose being popping out. I mean, because if you wear it properly, would all help you, would help the others, and would help you. I mean, but mainly the others of preventing its spread. It is a problem in some people who have breathing difficulties, etc. They get an exemption, a specific exemption. But overall, as a community level, I think that that process is something to be, especially when there's sort of transmission, etc., to prevent it. That would help in some way to preventing the transmission occurring.
Professor, sorry, I'm just putting you on the spot, but I mean, when you're actually out of Sri Lanka and you look at what's happening all over the world, and you tend to kind of develop some kind of trends. The specialized agency from Chicago, I think, is speculating that by the 1st of June, we might have deaths going up to about 200, and somewhere around 1st of September, it might be like 20,000. Now, and this organization has not faltered in their forecast also, because of course the models they use and the experience they have now is the curve is the learning curve is now coming in. Now, how does a country react to these kinds of forecasts, which, I mean, typically Sri Lanka cannot react. I mean, Sri Lanka, I mean, we are a poor country. We don't have the infrastructure to kind of ramp up so strongly. What do you do, Professor?
I think, as Rukshan said, go back to basics. I mean, go back to Sri Lanka has a wonderful tradition of being able to control things. We have one of the excellent sort of childhood immunization. So we have the skills, but it's important to use all those skills. Different people would have different skills. I would say if there is community transmission, indicating there is community transmission is it will tell the people, okay, you have to take one more step, because otherwise people will think, oh, there's no commit transfer, so why should I why should I do all this, why should I not do this, why should I can go for a wedding, I can do it for a funeral, etc. So that is the double-edged sword of, when there's community transmission, if not telling there's community transmission, etc., because that can be a negative effect. People won't take it too seriously, say if you're out of Colombo or elsewhere. So the thing is, I think every one of us, every individual person in the country has their role to play. I think the medics, and it's a team of medics. It's not one medic, but it's a team of medics. You know that when there's a committee, you can have, the disagreements, etc. But, discuss it out there and then come to the best way forward for the country. And if everyone buys into that, I mean, you will never get 100% people buying, because that doesn't happen. The 80-20 rule, I mean, at least if a majority says, okay, this is what we will do, rather than expecting everyone else to do it, if every person, if they can, we could do to help this, using the wonderful, I mean, Rukshan beautifully said the good things that are available to get this bandwidth. So we know that models are there, certain models are good, certain models are not good when it comes to disease prediction model. But I think these are all guides to, consider the models and then take the best mitigating steps in the scenario you are working in. That's exactly what you will do in business. That's exactly what you will, when you're hit by a certain event, you will assess it, you'll see what are the things you have, what are the weaknesses, try to close the weaknesses, what are the strengths, use all of the strengths. We have a lot of strengths in Sri Lanka, and take the message, if it's the mother of the household, focus on the mother and get that message across through the mother, because she's the one who is the important person. So, those are very well, and the community physicians, etc., would know that. They will know that specific. I mean, the network of people who are there in the country should be made use of to pass on. Each person passing on a message is quite useful to bring the pandemic under control. So it is not only, you saw, I mean, US threw money and they threw thousands and thousands of dollars, but it doesn't just mean throwing thousands of dollars. It is using the thing properly, coordinated, clear messaging, simple messages to the people so that they will take action on those simple messages and take it serious. They will take it serious. They would not change and move from direction, try to always break what is being indicated.
Dr. Rukshan, time has really caught up on us, but can we have some concluding thoughts from you, sir?
I would say stick to basics. Give the message across to the society through empowerment of the mother of the family. Through the message should go, and the medical office in each division in Sri Lanka district have a role to play here, and they should be the take the initiative in taking and also I have to say, we should. I have a question to Suranjit. If we do this for a continuous 3 to 4 weeks time, 3 to 4 weeks, I have a feeling we will reduce the caseload hell of a lot. But then still, if our country is open to the world and the people are traveling from there, then we have to have how we manage contain SARS, how we manage avian influenza. We influence by strengthening the entry points in Sri Lanka. One of the major entry points is we know Katuna. That's it. I mean, we don't have hundreds of entry points to manage. We are an island surrounded by sea, the ocean. We don't have a lot of entry points. So we need to control the entry point. And with that, if we can, nicely, launch an initiative to say, save Sri Lanka from COVID. Concentrate for 3 weeks at least on breaking the transmission within the public. We might have a big success, and of course Vaccination is a very good and very important aspect of this, control. But by just doing the basics before continuous, but everybody has to participate. In order to involve the participation, we are not doing enough awareness. That is my thing. So raising the awareness, promotion, the health is very important as it was so during our previous experiences. Thank you.
Thank you very much, Doctor. I mean, actually, being part of the government medical fraternity, and of course, being the head of the Kalaboila Hospital, the kind of manner in which you came onto this platform, I was actually pretty worried, actually, because the questions that one can ask you, but the manner in which you handled it is just shows a lot of maturity, and I'm sure Professor Suranjith must be so happy, because at the end of the day, his dad was part of the grooming exercise of you, Dr. Bell.
Ranta, I'll give
Yeah.
you a secret. He is related to me.
Oh, really? Oh my God.
We are related. Senaratne family is related to my mother.
Oh, no wonder
Very
you're saying
well.
Ruksan. But Professor, I mean, do you feel that you could have changed something if you were in Sri Lanka and not in the UK?
No, I think I would have contributed it always. I think what I believe is all of us can contribute in any way we could do. Certain people contribute right at the front, certain people at a distance. And I think we all should take it on ourselves. And now Rukshan, and it be so important, because you all are running the things, right? So very important. I think it's very important for views to be taken from others. Some views are not appropriate. Some views may be practical to Sri Lanka. Then sort of sieve it out and see what is the best. And I mean, Rukshan has a lot of very important take-home message, like focus on preventive, because that's the important thing. Vaccines alone is not sufficient. Preventing the condition in concert with vaccination is what is needed, and that's very important.
Professor, one final question to you. I mean, we are very proud of having exported one of our best talents to the UK. But you continue to serve Sri Lanka so much. I mean, I see the views that you express in different papers, and right now everybody's trying to understand about this pandemic, what to do, and the only way that you can give some kind of direction is through communication, which you are doing so good. And whenever I see something from you, I stop everything and I read it, because you talk so much of sense as to how you need to do, and I'm so thrilled. My classmate and my good buddy, Dr. Bellana, he gave so much of thought. Actually, you stop wondering and asking, why is it that you're blaming the government, blaming everybody, when actually it is not them. We have not behaved ourselves properly, and that's why we are now come to this situation. But Professor, my question to you is, now UK has curtailed it. I mean, the other day I was talking to the High Commissioner, Her Excellency Saroja Sirisena, and Her Excellency was saying that, I mean, we also had the situation where 1,500 people were dying on a daily basis. But then, we had to go for the lockdown, and then we contained it. And then, after all that, we've been able to now come to a situation where now open for business to a certain extent. But my question, Professor, is that we know that as soon as you open the doors, and you're going to again have another run of this. So how do you, I mean, you can't keep on, that hammer and dance approach continuously. I mean, don't you all have doesn't, I mean, the most intelligent people in the world are the doctors. I mean, you were like, I mean, a gold medallion, who won 10 medals, and I'm sure Dr. Fauci and, the likes of the world, are the most intelligent people. I mean, we are not doctors. We are in marketing. And if somebody comes with a problem to me, I mean, I will skin myself and come out with a solution. I mean, it's going to take some time, but that's what we are trained to do. My question is, why has the medical fraternity failed on this, Doc? I mean, I can't, you know what I'm saying, no, Professor?
No, I absolutely. And then what Ruxana said, you have to have a good world body who will coordinate this whole aspect, because due to geopolitical situations, you found that the WHO was sidelined for a long period when America sidelined, and that was a big hit to the WHO, sort of a very, very big hit. And I think COVID really put a big focus on preparedness. We were sending people to the moon, we were trying to send people to Mars, etc., all that sort of thing. And then a tiny microscopic virus came and just changed the whole picture. And I think first thing is to control this pandemic. Social distancing and wearing masks, hand washing, etc., together, preventive, together with vaccines, will hope to revert this whole process as shown in many countries. And the other thing is then to get it, probably it might come to a situation like influenza, where every few sort of months, every year or 2 years, you get the vaccine and get it under control. But then I think the world has to get back into rethinking it, looking at the thing. It's not just pointing fingers only. What can you learn from it? What positive aspects can you learn? What wouldn't you do in the future? Those are the important things, so that you don't want to cause the same mistake twice, thrice. And sort of trying to find out what should we do in the future to prevent such a process occurring, and how can a more coordinated body come in, where it's only not only the rich countries can get say vaccinated or PPE, etc., but it is a global effort, and it's a combination of all things.
Sir, sorry, I have to ask this question from you, because I have so much of respect for you. Is this actually man-made, or was this natural, Professor, in your view?
From all the understanding that we had looking at the scientific paper, that it was crossed from the bat through another intermediate hole. People will discuss it. I mean, that's not my specific area of interest on that transmit, because the virologists are I'm more on the immune aspect of it, and that's why I speak a lot about vaccines and the immune treatments for COVID. But listening to the experts, and there's always 2 points of view. There are different people who would give that, but listen to lots of the experts that it was a transmission. But I think we'll get more data as it comes, as things move further ahead. But I think virology will be far better to explain that specific point of where it, the sort of the sequence changes, etc. But I will definitely go on to the immune part of it. That's where I have a bit more expertise.
Thank you very much, Professor. And it's beautiful talking to you. I mean, it's actually an honor to have both of you on this platform. And thank you sincerely for
lovely too.
coming on board. And it's lovely. Please stay safe. And I'd like to hand over to Kaushali. Both of you guys are really doing Sri Lanka proud, and coming from the same school, it gives more kind of depth to this whole discussion. So I really appreciate, sir. And Kaushali, over
Rohanta, you are a marketing expert, I suppose, and you need to answer 3 questions. One is where were we? Where are we now? And where we have to be next. 3 questions. When we answer those 3 questions, we might have to play a little, because I'm a manager, medical manager. I'm not a clinician, but we need to be little critical about our. It's not a blame game, but we need to have a self-criticism to go to the next level. In answering the question, where we were, where are we now, and where we have to be, we have to focus on aggressive approach, as well as the self-criticism is very important. Right? So this is what my thinking, because I am a manager, administrator, but unfortunately others may not be so. But I think marketing point of view also, this approach is probably there. Sometimes you marketing or whatever management.
I'm actually honored to talk to you, Dr. Wellner, because you gave so much of insight to the normal discussion that's happening right now in all the media, where everybody is pointing fingers. But you just asked a very simple question. I said, guys, you don't need to put a lockdown during Aurudu. You should have known how to behave yourself. There's a pandemic. I think it makes a lot of sense. And it's ultimately it's our understanding of not knowing what to do with ourselves, then we want to behave in our normal sequences that have resulted in today's situation. And I think I really appreciate. Kaushali, over to you, Kaushali.
Thank you, Doctor. Indeed, such an apt, timely discussion from both of you, Dr. Bellana and then Professor Suranjith Seneratne. Thank you very much for all this knowledge and a very interesting criticism that you shared, which is extremely needed at this point, especially for our students, for them to understand how do you actually become realistic when you really have to be, and how do you become fact-based researchers when it has to be looked into, and specifically when it has to be reviewed in a situation of this nature. So on behalf of APIT family, thank you so much again for both of you, and we wish you all the very best to continue the job roles that you're continuing right now, along with all the interests that you have. And while wishing all of you all the best, it is another end of our session. It is indeed another end of a session that we conducted in this series. So we hope to see you back again in another week's time. And until then, good night.
Thank you.
Thank you.
Thanks so much.
Thanks.
Thank you
See
so
you.
much. Good night.
Bye bye.
Thank you.
Bye.
Thank you. Bye.